We have this webinar is being recorded as of right now, and it will be posted at a later time for anyone who does not join us today to be able to see it. As I said, I'm the moderator. My name is Evelyn Mantilla, and we have two wonderful presenters today. Gina Breton, who is the brand and the advertising manager here at Access Health, and Keisha Stouffer, who is the communications marketing manager at Access Health Connecticut. The agenda today is going to bring us important information for consumers. We will also cover recent changes affecting consumers, as well as renewals, and we will, as always, discuss opportunities to partner with Access Health Connecticut. With that, I'm going to hand it over to Gina to start the webinar with important information for consumers.
Hi, everybody. Thank you for joining our webinar today. We love presenting our 101 and adding in the renewal information today for you so that we can continue to reach new partners in the community as well as those who enroll our consumers in communities throughout Connecticut. So this is a basic overview of what Access Health Connecticut is. We were an organization that was established as part of the Affordable Care Act, and we offer quality, affordable health coverage to Connecticut residents and employers through our small business products. It's important to note that because we are tied to the Affordable Care Act, we are the only place in Connecticut where you can come to receive financial help to help pay for the cost of healthcare coverage. And that does include, for some folks, reducing the cost of their premiums, and for other folks at another financial level, also includes financial help to pay out-of-pocket expenses that might come up. Our mission remains the same since we were established just about 4 years ago. It's to increase the number of insured residents in Connecticut, retain our current members, and improve the way and the information and education available for them to use the benefits that they get. We promote health, and we hope to offer, affordable cost plans, and of course, last but certainly not least, to continue to work to eliminate the health disparities that exist here in Connecticut amongst our residents. So a little bit about Access Health Connecticut. We are currently in our fourth open enrollment period for qualified health plans. And it's important to note that although our open enrollment began on November 1st and does end on January 31st of 2017, that consumers who qualify for Medicaid can enroll year-round. And you can always use our website and the eligibility tool available in our application to determine if a consumer can enroll in Medicaid, and they can do so year-round, which includes, of course, outside those dates that we just talked about for open enrollment. All of our enrollment assistance is available and free to consumers, so we never charge for the help that we offer. And we do offer assistance online via our website, accesshealthct.com, over the phone with our call center representatives. And then during open enrollment, you can receive free in-person assistance throughout Connecticut, and we'll touch on that later about where those locations are. It's important to note, too, that over 76% of the customers that we serve that purchase a private health plan receive financial assistance. And so there's a misconception maybe sometimes that a lot of folks in Connecticut wouldn't qualify for financial help, and in some cases don't realize that they would. So a simple browse of our website can easily establish that a consumer may qualify who doesn't even realize it. And it's important to note that high percentage of folks that do qualify for some type of financial help through our organization to pay for the cost of coverage. And last, certainly not least, just covering off on this slide, there is a penalty that you do pay for not having healthcare coverage, and the minimum amount that would be for an individual is $695 per adult, and half of that value for a child. And so when you look at the benefits that healthcare coverage can offer, especially if you're receiving financial help to pay for it, it does start to offset the cost of perhaps paying that penalty each year. So just a little bit about, why we think healthcare coverage is so important. Of course, it plays a huge role in maintaining your health, but it can also play a huge role in improving your health and the health of others in your family. Using the benefits that you receive with your health plan, especially the preventative services available like annual checkups, can certainly, uncover something sooner and really start to improve the overall health of you and your family. And it's really just peace of mind for the unknown. So should an accident occur, you can live with the peace of mind knowing that if you do need to go to the emergency room or there is an unexpected emergency tied to health in your family, that you're not going to have to worry about large medical bills from hospitals on the other side. So we love this slide. We include it in all of our 101 presentations. It's key features of the Affordable Care Act, which sometimes we think, as of late would get lost in some of the headlines that you read. And so it includes the fact that you cannot be denied for a pre-existing condition, which is really, really important. And it also establishes the free preventative services that are available in network, along with some of the information about the products that we offer small businesses, which do include tax credits for those that come through the exchange and find benefits that they can offer their employees. But it is a great slide that just sort of talks through the key Affordable Care Act features that are offered as part of our coverages. So a little bit more about the essential benefits that are covered under all plans that are offered through Access Health Connecticut. They include, of course, outpatient care and trips to the emergency room, also treatment should you be admitted, pre- and postnatal care. It's important to note that all plans include mental health and substance abuse disorders, and the services that support those, because that's not something that's very well known, but it can be, something extremely helpful to our customers. It covers prescription drugs, services and devices. If you are recovering from an injury, you have a disability or a chronic condition, lab tests. A really important one, which I would say is number one, which are these preventative services that are offered. The most important being that annual checkup with your doctor each year that can really start to establish lab tests that are relevant for you and your age and your specific conditions and your specific health background, that can really start to help you improve your quality of life and sustain it for you and your family. And then last but certainly not least, pediatric services are covered under all plans offered through Access Health Connecticut. So for 2017, we are offering plans through Anthem, Blue Cross Blue Shield, and Connecticut, and of course, Husky Health, which is Connecticut's Medicaid and Children's Health Insurance Program. Again, it's important to note, for open enrollment, it began November 1st and it goes through January 31st of 2017, and that is when plans are available under Anthem and Connecticut. And then again, if you qualify for Medicaid or Husky Health, you can enroll in that program at any time through Access Health Connecticut. We love this visual because it really starts to establish those income limits that we talked about earlier for how many of our consumers really qualify for financial help, which is almost 80%. And so you can see for a single individual making, roughly $47,000 a year, they would qualify for some piece of financial help to pay for the cost of their coverage. So again, somebody who's single and living on their own, that's a significant number to help them understand that it's important to have health care, but that it can be affordable for them. And then sort of looking on the other side of this visual, a family of 4 can make up to $97,000 a year and qualify for financial help to pay for their health care. So when you look at the cost of health care, but you look at the financial help that's available for families in Connecticut, it really starts to establish that it can be affordable for you and your family and should be an option, especially just to take a look at it during our open enrollment period. This is another great slide that takes you through the application process. So first you would shop for plans, and then you, through the application online or over the phone or with somebody in person, would put in some key information about where you live, who's in your household, and your income level. And it would essentially apply you for that financial assistance and really determine your eligibility for what types of financial help you are eligible for. At that point, it would take you to the screens for selecting a plan. And when you're selecting those plans, you would in turn see what plans and what prices would be eligible for you and your family based on the financial help. So you would start to see how much those plans cost with that financial help sort of baked in to the pricing. So once you select a plan, this is a misconception, you really think your application is completed. But once it's submitted to Access Health, you can be asked to provide verification of that information that you provided in your application. For example, that could include proving your household income by way of a pay stub. It could also include proving other pieces of their application, like your citizenship. And so we would send you a letter requesting additional information, and it would become really important for you and anyone in your household to make sure you submit those documents so that you can really start to complete that application. So once we've established all of that information is complete and has been verified if necessary, that's when we go ahead and submit the application to the insurer, and that's really when your coverage begins, and you would expect to see the ID cards in the mail and on, to getting to build that relationship directly with your insurer. So this is a quick checklist of some of the information, or all of the information really, that you would need to enroll. And we can't stress the importance enough of, if you can bring this information with you or have it all together at the time you enroll, it does help our enrollers get through the application quicker with you, and it also would avoid a lot of the requests for verification of information afterwards. And so having this information can certainly expedite the enrollment process and really help the consumers in the community by letting them know this in advance if you're going to be meeting with them, so they can start to pull it all together and really go into the enrollment having all the information they need to complete the application. So these are some pieces that you should expect after you enroll, which is really important because it's not about applying for coverage and getting the coverage. It's really what to expect after, because these are the pieces that become really important so that you can start to use the coverage that you get and really reap that benefit. So first, you would receive a confirmation letter from Access Health and your insurance company. And so not receiving either of those letters would be a red flag, and you'd want to contact us back to make sure that everything went through and that your application is indeed in process. 5 to 10 days after you enroll, you would receive the first bill from your insurance company. And so there would be another red flag. If you're saying, hey, I completed my enrollment, but I haven't received any information from my insurance company about the first bill, you're going to want to go ahead and contact your insurance company, because it is really important that you pay that first bill to activate your coverage. About 1 to 2 weeks after you enroll, you would receive those very important ID cards, and that's what you would take with you to your healthcare providers or your pharmacies to start to use the benefits of the coverage and the plan that you selected. And those come directly from your insurance company. So if you wouldn't have received those, you're going to want to go ahead and call your insurance company to make sure everything is there. And they can also help direct you to print them off online as a temporary way. If you have appointments that are already established with your healthcare providers, you can, follow their instructions once you can contact them to print those temporary versions so that you can not skip any appointments and you can keep your prescriptions filled as needed. And we really can't stress this last piece enough. Knowing your plan and working with your insurance company and having an idea of the in-network providers and pharmacies that work with your health insurance company and that are in-network for your plan will help you reduce the costs associated out of pocket with your health care. And so Access Health has a ton of this information on our website, as does your insurance company. So really take a look at those pharmacies and doctors that are in network, because that is going to help you keep the cost to you lower and as low as possible for the benefits that you receive. So this is another great point. We do offer dental coverage through the Affordable Care Act. So all plans through Access Health Connecticut include free pediatric dental for children. If you need a standalone dental plan for the adults in your household, we do offer plans through Cigna, and you can learn more about these options by visiting the website accesshealthct.com, and we've got a nice little arrow pointing down to our dental patient sitting in the chair there, and you just click her, and she's going to take you to a site where you can get pretty quickly information and pricing about those standalone dental plans that are offered, again, for adults who might need access to dental coverage in addition to health. But again, this is only for adults, so that's going to be adults over the age of 19. Anything under that age is going to be covered under the pediatric dental coverage in the regular health plans that you get through Access Health Connecticut. So this is just a quick slide that talks through some of the accomplishments we had as of last year's open enrollment. And we're hoping for a lot of these same numbers to come through the doors this year, realizing that there is a need in Connecticut for residents to be insured. And so we have worked really hard over the last 3 years to reduce the number of uninsured residents left in Connecticut. And it's really under 4% now, which is why we rely so heavily on our community partners to help us find and communicate with those that are left, this 4% of residents, to let them know that there is affordable access to healthcare coverage for them, and just to take a look. And so we know that you're trusted community members that can really connect with these folks who are left. As of last year's end of open enrollment, we had approximately 116,000 enrolled in private health insurance qualified health plans. 61,000 of those were new customers, and you can see the breakdown in that between those that purchased private health plans and those who actually were new members and qualified for Medicaid. And so to date, we have nearly 600,000 enrollees in our Medicaid program. So again, it's just really important to realize that we serve a tremendous amount of residents in Connecticut. And it really speaks volumes to the community partners we have and the information that you all are able to disseminate to our residents to help them get the coverage that's available to them. So we keep talking about a lot of different dates. So if there was a slide to pin up on in your desks, or to post online in your community newsletters and other things, it's going to be these dates. November 1st is when open enrollment began. And of course, January 31st is when it ends. But it's important to note that for your coverage to begin the first of the year and really go uninterrupted, especially if you're renewing with us, you're going to want to enroll customers or renew them by December 15th. So that is a deadline right in the middle there. It's the early part of open enrollment. It's a great opportunity to get ahead before the holiday rush and the rush that comes, of course, towards the end of open enrollment. But we really do encourage as many people as possible to enroll by December 15th, because we really don't want them to have any lapse in their coverage. And we really want them to go uninterrupted, especially if they rely on monthly doctor's appointments or, more importantly, monthly prescriptions that they may need. And this would offer them no interruption in their coverage because it would begin at the first of the year. This is another great one to print out. This is going to be all of our different enrollment channels. You've got online, our website, our phone number, where you can talk to a representative if you have questions. And then you can always click our Get Help tab on our website. That actually takes you to a zip code lookup. So you can quickly just type in the zip code that you live in or that your customer lives in, and you can find enrollment information and help right in those neighborhoods. So Connecticut's a small state, but it can be very big, especially when you're looking for help. So we realize that zip code lookup is really important to connecting our customers to the help available to them throughout the state in all four corners. So just reiterating, there is a tax penalty, and it is significant. It's $695 or more per adult, and sort of skews up depending on your income. So when you start to balance, should I pay $695 and not go covered and not have that peace of mind, or pay something for healthcare? Maybe you get some financial help built into that, and really find yourself with that peace of mind that you're covered should something happen. You really start to weigh those benefits, and it is something to note because that penalty is there, and does come all at once in April. So you really want to help customers understand that you don't want to have to pay just a fine that's sort of empty. You want them to pay for something that can help the health of themselves and their families. So this just gives some information about, this is a great example of a young person who, they're going to think they're very healthy. They don't need insurance. Well, depending on where they fall and where their income falls on that federal poverty level, that could be a substantial fine, looking at their income. So it could skew upwards on, over $1,000 depending on where their income falls. And so making sure that they know that $695 is the limit for the least that you would pay as an adult. So just something to consider, especially for our younger, healthy folks, who maybe think, oh, I don't get sick, I'll just pay the fine. It can really start to add up as your income climbs. So we talked a lot about open enrollment and the open enrollment dates between November 1st and January 31st. But again, there are special enrollment and qualifying life events that would enable someone who qualified to purchase a private health plan outside of those open enrollment dates, because sometimes you find yourself in a position where, hey, I don't have coverage, and Access Health and the Affordable Care Act recognize that. And it's important to note that if you just got married to another Access Health customer, you can join their plan. If you were just divorced and you find yourself without coverage, that's another special qualifying life event that would open up a special enrollment period for you. So all of these are some of the top reasons why somebody would qualify because of what's happening in their life to enroll outside of those open enrollment dates in a private health insurance plan. If you lose your job, if you just moved here, you weren't here for open enrollment, and you might find yourself without coverage. So you really want to stress that, maybe you encounter these folks outside the open enrollment period, but getting a little bit of information of why they're not covered, and it can really establish that they do qualify because of one of these life events. And that special enrollment would allow them 60 days to enroll. So it opens up a very, pretty large, 60 days is a long time to consider your options and your plans, and to select and enroll in one. But realizing that above open enrollment, beyond it, before it, there are folks who are going to qualify to enroll in private health insurance outside, depending on what life events might occur for them. So a couple of quick updates. We continue to put our customer in the middle of everything that we do, and you may have read that we have a new call center vendor, and we're really excited about them. We feel that we are going to, we've put a lot of time into training these folks, and we feel that they're a great partner of ours. They're local, and so our call center has sort of been revamped in a lot of ways. And so when you call this year, we encourage you to give our new call center a chance. We realize, in the past there have been longer wait times, et cetera, and we're really looking forward to the performance and have already started to see the results of implementing our new call center. And so we ask you to, we realize that there was a past and that our call center maybe always didn't offer the best support possible, but we've done our due diligence over the past year to ensure that our call center moving forward is a great resource, both to our customers, but also to enrollers in the community. Carriers, so our insurance companies we worked with, you might have saw that this year we have 2 insurance carriers, be it Anthem and Connecticut, offering plans. This past summer, there were more headlines. We did lose 2 carriers for different reasons. So our customers that are currently enrolled in Health AHCT or United Healthcare, which were previous insurance partners of ours, are going to need to choose a new carrier in addition to a new plan. And so you'll hear more from my colleague Keisha about our specific outreach to those customers, realizing that not only might they need to choose a new plan as part of the renewal, but they'll be also choosing a new carrier, be it Anthem or Connecticut, which are those that are moving forward. Another headline that's come up is brokers, broker commissions specifically, and Access Health has done what it needs to do to bring brokers into our call center and our enrollment centers so that we can ensure our customers have a resource should they need to choose a plan and have specific questions where a broker can help them recommend a plan that can really benefit that customer specific situation. And so please know that there are brokers available, through our enrollment center and our call center for your customers to utilize, because brokers are the only folks that can recommend a plan based on a health situation. And then last on our updates here, you've got our year-round outreach. And so I think you're seeing some pieces of that, before open enrollment happened and even throughout the summer and spring. This was the first year we took a year-round approach to outreach. And so we've built up our community partner list, and we've really started to work with our partners throughout the year. So just as important as open enrollment and the time right before and the right after is to communicating, connecting with you all. I know there's some slides later in this presentation that really speak to our year-round commitment to working with you and understanding the events that we should be at in your communities and the people we should be talking to. And so that year-round outreach is a new piece of our puzzle here at Access Health. And the marketing team especially looks forward to working with you all year round, because health insurance and enrollment happens at a very specific time usually, but using the benefits of your coverage and understanding why you should enroll and what's important to our customers is important to us. And so we realize that that takes more than a couple months a year. And so you won't see us going away by any means. We are here year round with outreach teams at different community events locally, and really like to hear from you about where we should be in your communities. So now I'm going to turn it over to my colleague Keisha, who's going to take you through some of the following up slides, more around our locations and our communications plans for customers.
Thank you so much, Gina. I really appreciate it. That was a wonderful part of the presentation. We are going to pass it on to Keisha. And before that, let me remind people that if you have any questions anywhere along the way, do not forget to type them into the chat box on the lower right-hand corner of your screen. So here is Keisha, who's going to discuss our enrollment locations.
Hi there. So our enrollment locations are a point of pride for us. We promote those pretty widely, so these might look familiar to you, but we'll go through it just in case. promote these online through social media. We send emails. There's advertisements. We really, the goal of this is to provide as many opportunities for customers to have face-to-face assistance for enrollment, for applications questions about coverage, and then also at some of these locations, they can speak with a broker and get a plan recommendation, which is really important. Some of our research shows and backs this up that a lot of people need several interactions with us to complete the application. So it's really important to have these opportunities throughout the state. And we'll see a map in a couple of the slides, but throughout the state near them, these locations were selected because these communities might have a lot of uninsured people. And we also wanted to make sure we spread ourselves across the state to provide at least some opportunity for people to walk in. This assistance is free. There's no appointment required. And if anyone has any, if you want to promote this list to anybody, there's a URL in the presentation for Learn More page that includes all the information, and we keep that updated. Let's see. Another important point with these enrollment locations that I think customers are not aware of is that if they have problems completing their enrollment, and Gina touched on that a little bit, but sending us those documents we request to complete your application, you can get assistance with that at these locations as well. So the next slide. So these are the 5 primary locations where we've set up shop. A couple of these have brokers. All of them have someone who can help with an application or answer questions. Another way to look at this is the next slide, which includes all of the certified application counselors. And this is a better way to look at really how far we have come in terms of spreading ourselves throughout the state and getting in touch with customers face-to-face, which again has been a lesson learned for us that there's really nothing that can replace that face-to-face interaction for enrollment assistance. And one more set of bubbles, and these are the DSS field offices. So again, all of the customers that come to us can be enrolled in either a qualified health plan or in Medicaid coverage, Husky Health. So let's see, I don't think I have anything else on that. Yeah. Move on to renewals.
All right.
Oh, hold me. Yeah,
Okay,
that's also
great.
me.
Absolutely. Thank you. All right.
So this renewal cycle was a little different for Access Health. We learned a lot about kind of how people were looking at their health coverage they were selecting and how they're using it. So we've learned some lessons, and I'll share those with you in a second. But in general, the primary goal for this renewal cycle is to get our customers to renew, of course, but specifically to renew by December 15th. So they start the year with coverage. I can't emphasize that enough because some customers were able to renew automatically last year, meaning that their information didn't change and Access Health could find a similar plan or an identical plan and renew them automatically. They didn't have to do anything. Well, this year, there are many more people who have to actively update their information for 2017 and select a new plan. So this does give us an opportunity to help customers think through the plan selection process a little more. A goal for us is to make sure that customers are making informed decisions about their 2017 coverage. A little more on that later. So for renewals, we have a dedicated webpage on the Learn More site. So it's learn.accesshealthct.com/renew. This page is available in English and Spanish, and it walks the customer through the process of renewing their coverage, including making sure that they can log into their account. Don't wait until the 14th to try logging into your account and thinking about your needs. It'll also include just the questions they should ask themselves. Do you go to the doctor a lot? Do you have a lot of prescriptions? Do you know who needs coverage in your household? This is the type of thinking that customers have to do before they press the button, the apply button, because changing your plan later might not be an option. And as we know, there are some misconceptions about the cost of coverage over the course of the year. So that's another thing we're trying to help customers wrap their head around. Premium, deductible, copay, coinsurance, these are words that customers may not have seen before. They might have had assistance and not had to think about these things. And it's important to try to retrain ourselves and the customers to think about the cost of care throughout the year and not just the monthly premium payment. The other takeaway for us was to remind customers every time we interact with them to keep their household information updated throughout the year and report changes as soon as they happen. So that can be that can affect a lot with the customers actually, and it can, in the case of income or zip code, for example, it could affect their tax credits that they receive, and they might not find out until the end of the year that their tax credit changed because they moved or because they got a raise, which is normally a really positive, good thing, but in this case could result in a high tax bill. Also staying in touch with customers if they don't update their address or their email or their phone number. When we do need to communicate with them, it can be much more difficult if they have not updated that information. So as you're interacting with people, please remind them to update their information in the system or ask for help to update. They can always call us if they have a question. So let's see. We're communicating about renewals in many different ways, and the most physical manifestation will be that renewal mailer. Customers should be receiving them as we speak up until the weekend. There are a couple of versions of the mailer, which I'll get to, but in general, they all cover this list of topics. It's helping prepare them to renew their coverage for 2017 or select a new plan, the process for picking that plan, and like I mentioned, things they should look out for, like do they go to the doctor a lot? Do they know how much they're going to have to pay out of pocket if they go to the doctor a lot? Other things like financial help that can help pay for coverage, and especially those cost-sharing reduction plans. And through our research, we found many people were selecting a different plan. Say, for example, they qualified for the silver plan with additional cost-sharing reductions, but they were selecting a bronze plan because what they were looking at was just that premium, or they didn't include their correct income, so they didn't qualify for tax credits. It's things like that in the education process that we can help better serve the customer, but we have to start getting them thinking about it too, and not just relying on someone to tell them what they should do. Of course, we list where people should go for help and the importance of staying covered and how to complete their enrollment. I mentioned that a little before. So I'm sure you guys have seen this. If a customer completes their application, they might start getting letters from us saying, we need proof of income, we need proof of citizenship. Unfortunately, sometimes they get many copies of this, and some people choose to ignore them or they don't understand them. And as a result, a lot of people can get terminated. Their coverage can be terminated if they don't provide that documentation. So that's another change for us this year. We're really trying to drive home the point of getting covered and staying covered. Some custom messaging that I'll touch on. Gina mentioned this before. We have some customers that might need some special assistance this year. So Healthy CT and United Healthcare will no longer be an option for plan or carrier. So those customers absolutely need to log in and check their information for 2017 and select a totally new plan. So we're doing some special outreach to those folks and also trying to provide a more direct connection with broker assistants to complete their enrollment. We know that they've received communications from those insurance carriers about this, but we just want to be sure that they know, as it relates to Access Health, what they need to do to stay covered for 2017. The other kind of special group we're talking to are households that have dependents turning 26. So you might be aware of that kind of 26 age out, and it's different in the exchange versus off the exchange. So for Access Health, the customers who have a dependent turning 26, we're trying to use them to communicate to those folks several things. So one is that they might not know that they're losing coverage on December 31st, and that's very important to know. Also, if they're still going to be claimed as a tax dependent, that means that now 26-year-old would not qualify for tax credits on their own coverage. So the whole family kind of has to discuss that before they move forward with their application, so there aren't any complications later. And of course, we remind everybody that there is a tax penalty for not having coverage. And one of our key messages we like to say is don't pay something for nothing. So don't pay a tax penalty and then still not have coverage. At least, if you enroll in coverage that covers you and provides some peace of mind, you can always fall back on that. So let's see. I think we can move to the next slide. These are some screenshots from the actual renewal mailer. This will be available on the Renew page. Like I said, there are a couple of different versions, but they all pretty much walk the customer through the same process. I say it's on the iConnect page. So I mentioned before we're reaching out on renewals in a lot of different ways, and one of you can see just a high-level list here. We've started sending emails to customers, and we do target those customers based on the carrier they had, or maybe the ages of the customers in that household. We're saying things. We're sending information like how to shop for coverage, what you should look for, like I mentioned, the tools that might be available online that they can use to better estimate how much their plan will cost them for the year. So like I mentioned before, we're trying to get people to start thinking about the plan they select, how it's going to serve them throughout the year with routine care and also emergency care. Again, mentioning the verification documents and paying your first bill, and that's all part of completing your enrollment so that you can actually start to use your plan. And in later webinars, we'll talk more about what we're trying to educate customers on how the best way to use their plan. But the first step, of course, is keeping their plan after they enroll. And of course, we're always messaging to customers about the financial help that's available and the special plans that they might qualify for. They just need to make sure their income is updated and give us their full household information. Other topics will be included in the emails. This is just high level. But we'll, of course, be messaging about deadlines and important dates. 12/15, everybody, big date. Those customers who might need additional assistance, and then letting people know if there's enrollment help near them that they can go to. Let's see, I think that's it. I don't think I have anything else.
All right, thank you so much, Keisha. I'm going to turn it over again with a reminder. Don't forget to type in your questions on the chat box. We want to make sure that we have a wonderful conversation towards the end of the presentation. So back to Gina.
Hey everybody. All right, so we just wanted to give you a couple previews of our advertising campaign that's happening and is launching Monday. This year's commercials are focused on renewals because we are in a retention mode this year, realizing that the number of uninsured is so low. We do look mostly in our focus to retain the customers that we do have. And so this year's approach, as you can see through these split screens, is deemed future self. And so through a lot of the research we've done over the summer and the concepts that we've presented to folks throughout Connecticut in focus groups, really showed that giving people that idea of their future self, talking to them and saying, hey, we know you just enrolled in your coverage, or you just renewed your coverage, that's great, and you're going to go for your preventative checkups, and in a couple years they're going to find something, but you caught it early, or surprise, you don't know it now, but you're actually pregnant. So we tried to play off some of those comedic life experiences that happen when you can kind of put your future self right in front of you at the present, and help them give or shed some light on why you're making the right decision by enrolling or renewing in your healthcare coverage. And so you'll start to see these commercials air on a number of different channels throughout Connecticut. But we do think it's a little bit out of the box, and we hope that it really sticks out to the residents of Connecticut, like, wait a second, well, my future self could easily be telling me something very similar, and realizing that it is important to have healthcare coverage. And so sort of paired with that and in tandem, and you've probably seen some of this over the summer, we run a ton of PSAs featuring UConn coaches, Gina Oriema and Bob Diaco at the moment. We've used others in the past, but it really speaks to the notoriety of these familiar faces in the community. And our partnership with UConn is longstanding. We're the official healthcare we're the official healthcare partner of the Yukon Huskies, so you might see us at the football games, for example, handing out information, connecting with consumers. But you know, it really, in a lot of ways, these PSAs will stretch through open enrollment and reminding people to enroll. But then you'll see a lot of versions where you've got these coaches talking about the importance of following through on their coverage, and that really entails verifying their documents and paying their first bill, so that they stay covered in those first 3 very important months after open enrollment ends. And so you'll start to see variations of these throughout the year, right on into the spring and summer, where they really start to stress, and did this past summer, especially during the Olympics, we were airing a lot of these, talking about the benefits of coverage, and that, you know, it's really important to get your checkups. And so working in tandem with these PSAs, we think, is a great approach, because it does stretch our campaign on TV a lot longer with really important messages. So our digital and social focus this year is sort of in that same vein of using your plan benefits, of course, important open enrollment dates, and the help that's available. And so you'll start to see these pop up in different places using sort of the target demographics that we have. But again, it's focusing on those core messages that we're here to help, that open enrollment is here, and then you'll see that have healthcare coverage, use it to stay healthy message, stretch far beyond open enrollment, and really connect with our customers beyond that point, realizing that it's not always about just enrolling. It's about using your healthcare coverage to your advantage once you pay for it and you have it for the year. So quickly, we'll go through opportunities to partner with Access Health, which again sort of speaks to our year-round outreach efforts. We would love to share information, and we'll continue to throughout the year, with communities all over Connecticut. You know, we speak at a number of different events. These are just a quick laundry list of some of the types of organizations and partners we have throughout Connecticut. But again, we're always looking for new partnerships, which is why we host these webinars ongoing to sort of disseminate that information. We have a page dedicated to our community partners, and you can visit learn.accesshealthct.com/community. And we've got important announcements, events, trainings. We've got all of our printable materials available there, our social media and logos, information about what you can post, and really quick nuggets that you can share with your customers and those that are part of your organizations. And of course, who to connect with to make sure that your community organization is represented. So we encourage you to continue to sign up for upcoming webinars. We do have a great number of them coming up in the future, and a couple more in addition to these. We have one coming up that's really been hotly participated in the past. This is why you're seeing that part 2, and it's immigrant eligibility, enrollment, and outreach. And so we realize that, you know, this is an important topic in Connecticut, and we'll be hosting an informational webinar on Wednesday, which is next week, the 16th, same time, 1 to 2. To talk about this topic with some other members of our organization. And then you've got reaching and assisting the LGBTQ communities, which is another great group of folks that we're really dedicated to connecting with. And so it's important, if you know organizations that support these folks, or you're one yourself, we really want to invite you to that next webinar on November 21st. There's a lot of great information about support for that community specifically through Access Health Connecticut plans and the access to affordable health care for them. And that information is there. Other topics that are going to start to pop up, we're going to be doing one sort of beginning of December. You'll see pop up on that community's page around financial help, and some tools available to our customers to help them understand the actual cost of healthcare coverage beyond those premiums. And so we'll have a couple more webinars popping up ahead of that all-important December 15th deadline to enroll for 1/1 coverage. And again, all of this is going to be posted. Bookmark this page. It's that /community page, because it's really for you and for us to connect. And this is just a preview of that site. We've got a ton of printable materials in a number of different languages. All of our Spanish materials are currently printable and posted on that website. But we do have materials available in 13 other languages. So if there's a language represented beyond English and Spanish that your community needs, we encourage you to connect with our outreach team so that we can coordinate delivery of those materials to your organization so you can help us distribute to those who need the information in their language, and that's perfectly okay because we definitely have it available. Just a quick, we've got a lot of materials, great page to kind of reiterate. We try our best in every circumstance to use words that are familiar and reading levels that don't go beyond 5th grade because health insurance is super complicated even for those who work in it. And so we realize that simplifying it down to what's most important is really helpful for everybody. We have a newsletter. If you're not already a subscriber to it, we definitely encourage it. It includes important updates about the organization, other opportunities to connect and communicate with us. So definitely look for that. You can subscribe right on that same page that's /community off of our website. So we encourage you to stay on our subscriber list for updates throughout open enrollment and beyond. Again, to contact us, there's information right on that website. There's also really important information that you can give onto your customers specifically around the different carriers and questions that they might have. The insurance company information is going to be available on our consumer page too, but it's always helpful, especially if you're communicating with folks online via email or you're sitting with somebody, to quickly pull the same information up on this community page. And so it's really a one-stop shop for you all to get the information you need to be helpful to Access Health and vice versa. So again, as I mentioned, our outreach team is always in the community at different events. And so should you have an event you think we should be a part of, whether it's a health fair, a family night, if you have an annual meeting where we can talk to a number of your constituents or your board or your organization in a bigger way, we encourage you to reach out to the email address that's listed there. Or you can fill out a form directly on that community partner website and we'll get back to you. And we really do believe, and it's important that we go to where you guys are in the community, and that's why our outreach team works year-round to do so. And this is another great slide to print. Here's all of the information on how to reach us, specifically around community outreach. And we do want to hear from you. There are a number of ways to get in touch with us. So if you want to call us, great. Email, you can always follow us at these hashtags using the information here. But we encourage you to stay with us year-round and really let us know what's happening in your community, because we do promise to do the same about updates for Access Health.
Wonderful, Gina. Thank you so much for that information. And we have now arrived at the segment of our webinar where we want to answer your questions. And I see that we have a couple of members participants that have put in their questions. So here's one. How can a consumer get assistance in languages other than English?
Sure. That's a great question.
Yeah, I can take that. So this is Keisha. We have enrollment assistance in person in a few different languages, and if I don't have the list, we can send it out, though, of which people will be at different centers speaking languages other than English. But via phone, we have over 20 call center representatives who speak Spanish fluently and take calls through the call center in Spanish. But for all other languages, we would employ Language Line, which gives us access to over 100 different languages that can translate a two-person conversation so that the enrollment can be completed. We do continue to seek advice and collaboration with different organizations who support languages. And I think something we're doing in a couple of weeks is sharing some of our materials that have been translated to make sure that if they have any input and how things should be said, that we can include that. and any other recommendations are welcome.
Excellent, thank you. Before I move on to the next question, let me let the participants know that we always want to do our best in providing the information through these webinars, and we constantly want to improve the webinars as well. In a minute or so, we're going to post a link on the chat box that will allow you to link to it and take a moment of your time to fill out the survey that's going to let us know how we did and what we can do best in the future. So let's move along with another question. Should I advise someone about what plan to choose?
So this is a really important question. We touched on it a little bit, but it's worth noting that should you reach a point with an customer who you're enrolling and they are looking for advice like, hey, should I choose this plan or this plan? That's really starting to recommend a plan. And the only folks that can do that are going to be a broker. So you're going to want to connect them to one of our enrollment centers directly if they're willing to, go there, or in order to finish that enrollment, you can give our enrollment center a call and they're going to be able to connect you directly to a broker who can help recommend that plan, looking at all of the information of that customer. Because again, brokers are a vital piece because they really do and are the only folks that should be recommending a plan. So if you reach a point and you need that assistance, Access Health is here to make those connections for you, so that you should never be advising on a plan to choose, and they can, finish the enrollment using Access Health to connect to that broker.
Great, thank you, Gina. The next question is the call center open on Saturdays and or Sundays?
The call center is open on Saturdays currently from 10 a.m. to 3 p.m. However, they are closed on Sundays. That's not to say that these hours on Saturday and being open on Sunday won't change. And so as we approach deadlines, we encourage you to stay connected to Access Health because we do work to look at the volume of calls as we approach major deadlines throughout open enrollment to ensure that our customers can connect to the call center. So you'll see throughout open enrollment extended hours and days. So definitely stay close to us on that. But right now our call center is open on Saturdays.
And one other thing to note, if a customer does call us while the call center is closed, they will get a call back when we open again.
Terrific. Thank you. Thank you. Amy, one of the participants is asking us if we're going to make the PowerPoint presentation available, and the answer is yes. Absolutely. We can send you a copy of this PowerPoint presentation, and it will be posted on our community page shortly, where you'll be able to see both the presentation, but also a recorded version of the entire webinar. And Amy says, thank you. So of course, you're welcome. I think we have time to take one last question. And let me remind folks that on your chat box, I posted a link to a Survey Monkey. I really beg you to take the moment at the end, before the webinar ends, to fill out the survey to let us know how we're doing. So one more question is it possible to get information on where CACs are located outside of enrollment centers?
Certainly. So the best avenue is going to be to go to accesshealthct.com and click our Get Help tab. And that's where you're going to find that zip code lookup. And so one of the check boxes you have to choose is if you're looking for a licensed broker or if you're looking for a certified application counselor. And so using that Get Help tab and that zip code lookup is going to be your best chance at connecting with a CAC who's going to be local to your neighborhood. And the easiest way to connect is going to be online, accesshealthct.com, clicking that Get Help tab and following the zip code lookup.
Great. Wonderful. With that, we're going to close the question and answer session for today's webinar. One last reminder, the SurveyMonkey link that we've provided in the chat box. It's very important for us to hear from you about how you benefited and what we can do to make these information sessions the best possible. I want to take a moment to thank all of the participants. Access Health Connecticut truly appreciates your interest in learning more and more as we move along in providing coverage to the consumers in Connecticut. So we really appreciate you taking the time to be part of this webinar. And with that, we say once again, thank you and have a wonderful rest of your day. In a moment, I will be closing the meeting and we will be all set. So again, thank you so much. Don't forget the survey.